Today, I'm really happy to talk about omega-3s. I will tell you, I am a big fan of omega-3s. I take them personally. I use them in my pets at home, and I really believe that there's a place for them in many of our patients, but also I expect we're probably going to see them a lot more in commercial pet foods or, any commercial food, fresh or dry, kibble or canned diets are probably going to start including more and more of them. So we're going to dive in and talk about them today. And I'm going to share some cases with you as well that I have treated and worked on and the benefits that I have seen. And so I had a really nice introduction from Jody there. I have been a practitioner for over 24 years. Several years ago, I decided to chase after my second love in life, first being veterinary medicine, but my second is nutrition. And I decided to do a alternative track residency, which means I kept my day job and I did my nutrition residency part-time, funded by me, not a pet food company. So I'm an independent and I continue to be an independent consultant. And now I spend more than probably 75% of my time still working with clients, doing homemade diet formulations with pet diets. But also we will offer commercial diet recommendations just based on the owner's preference and try to do the best we can with that combination. So as a review, if we're talking about fats, including the omega-3 fatty acids, we also call them lipids as nutritionists. And so what are lipids? Lipids are mostly triglycerides that come in our foods when we eat them. And triglycerides are basically a glycerol backbone, and they have 3 fatty acids attached to the side of them. Lipids also can come in our foods as phospholipids or cell membranes of other foods or things we consume, and they also are cholesterol in our diets. So we talk about the nomenclature. Fatty acids are named by the presence or the absence of double bonds along that carbon chain. So we can call them saturated or unsaturated, and that refers to the number of hydrogen atoms. This characteristic will influence whether they exist as a solid or a liquid, and it also influences how shelf stable they are in products or in foods that we buy. And so what are the types of lipids? Again, mentioning saturated fatty acids. These have no double bonds in their carbon chain. These are what we think of as animal fats primarily. Things like lard or coconut oil are going to have more saturated fatty acids in them. If they contain one double bond, we will call them monounsaturated, and the most well-known example is olive oil. And of course, if they contain many double bonds, then we're going to call them polyunsaturated, and these fatty acids can be either animal or vegetable derived. These bond characteristics are not just important for their naming, but they, as I mentioned, will confer certain physical characteristics to the fatty acid, and that can also influence how they affect cell function in the body when we consume them. And lastly, we have the trans fats. I mean, we talk about those a lot in human medicine. Trans fats are referring to a double bond being in a trans position rather than a cis configuration, and they occur naturally in small quantities in some animal products, but they also are artificially produced through the chemical processing of fats. And of course, a lot of negative press has been given to trans fats, but we actually have very few studies on examining them in our pets when they ingest them, if they have any negative health effects. And of course, I think they're probably pretty rare for us to come across them in our pet foods. And so where do the omega fatty acids come from? They definitely have couple of different sources in our diets. The omega-6s will come from plant oils, nuts, or seeds. And then the omega-3s can come from primarily the marine sources as fish, phytoplankton, or algae-based ingredients. We'll also see them in krill and calamari oils. And they also can come in some seed oils and nuts. And so what determines the essentiality of fatty acids in our diet is primarily that the body cannot produce them. They basically have to be consumed within the food that they eat. They must be consumed in our diets. The omega-6 fatty acids, linoleic acid, is essential for both dogs and cats. And arachidonic acid is essential for cats only. This is thought to be an adaptation to them being a true carnivore. They lack an enzyme called delta-6 desaturase, which means that they must consume arachidonic acid in the foods that they are eating. In omega-3s, we do see an essential requirement for alpha-linolenic acid. It is essential for growth and reproduction. And then we also have an essential requirement for DHA for both growth and reproduction in puppies and kittens. And so what happens if we have a deficiency of our omegas in the diet? If we don't take in enough omega-6 fatty acids, we're going to see skin and coat abnormalities. Linoleic acid is important in the transepidermal water barrier. And so if we have a poor diet in the early stages in life, especially I think about puppies coming out of shelters that have been on poor diets, they may come to you with coarse and dry hair coats. They may have itchy skin. They can have secondary infections. And for these guys, I might be thinking of giving them one of the omega-369 combination products. But we can also see reproductive problems, a failure to thrive, and decreased growth rates if there's not enough omega-6 in the diet. And with omega-3 deficiencies, we can see neurologic abnormalities. We can see polyneuropathies, reduced learning abilities or thinking, cognition behaviors. We can also see poor retinal development, and this can result in decreased visual acuity. And so one thing I come across a lot of times is homemade diets. It's common to have owners come to you with a homemade diet. Either they're winging it on their own, or maybe they found a recipe on the internet and there's actually no fat source in that diet, or they're using a super lean meat or whitefish, and these diets often can be deficient in omega-6 fatty acids. And then we'll also talk about different ratios and what about relative deficiencies. If we have intakes of excessively high omega-6 compared to the omega-3s in the diets, is there some concern about that? And yes, there is. At this time, we are studying that. We're looking at what the optimal ratio in a diet might actually be. We haven't defined that specifically yet, but definitely we're thinking the lower this ratio, meaning less omegas, omega-6s and more omega-3s, is probably better for both us humans and pets. So next we can just mention briefly the physiologic roles of omega-3 fatty acids. They can function as membrane components. They have some function in membrane fluidity. They can function in protein localization and ion channel function and signaling. They also are substrates for signaling molecules, so they end up being transformed into eicosanoids, prostaglandins, leukotrienes, and even the endocannabinoids within the body. And they also function in receptor-mediated signaling. So outside the cell, extracellularly, they're important, and they're also important in nuclear receptor functioning as well. All of these play together and can have impacts on various organ systems throughout the whole body. What about inflammation? I'm sure you've heard discussions about omega-3s and their impact on inflammatory states. And we know that arachidonic acid, or the omega-6s in the green box on the left, have some function in inflammation initiation. And this is a normal response. So any type of injury, it is a protective response. The body will take arachidonic acid and it's converted into leukotrienes, thromboxanes, and prostaglandins. And this will also induce an enzyme called 15-LOX that can switch over at some point into producing less inflammatory eicosanoids. And this is what happens during the inflammation resolution phase when the body is attempting to return to homeostasis. And so this is going to draw upon other types of omega fatty acids, primarily EPA and DHA, as they are converted to some of the inflammation resolving molecules, which are mentioned on the bottom, lipoxins, resolvins, protectins, and the muresins. And so looking at this another way, we can kind of see the flow, how essential fatty acids are converted through multiple enzyme steps. We start with the parent molecules, linoleic acid and alpha-linolenic acid at the top. Linoleic acid is going to be converted through a series of steps down to those eicosanoids at the bottom again, prostaglandins, thromboxanes, leukotrienes of the 2 and 4 series, and these are thought to be pro-inflammatory, pro-aggregatory, and they can result in vasoconstriction. And these are found in vegetable-based oils, including borage oils. We can also see them in some of our animal tissues, and they do also come to us in pet foods. But on the right side, we can see the omega-3 series, starting with a parent compound, alpha-linolenic acid, and that is primarily found in some plant-based oils, flaxseed oil being an example of that. And these are converted into the eicosanoids through EPA and DHA at the bottom of the prostaglandins, thromboxanes, leukotrienes of the 3 and 5 series. And so the limiting step is from ALA to EPA and DHA, but these ultimately can result in less inflammation. They are anti-aggregatory, and this can result in vasodilation. And so these primarily come from our marine sources, the fish oil, again, calamari, krill, or algae-based oils. And so these steps require enzymes. So we have to remember that to make these conversions, there must be enzymes that work efficiently in order to get to those biologically active molecules. And unfortunately, cats will poorly convert linoleic acid to and alpha-linolenic acid to the active polyunsaturated fatty acids. While dogs can minimally convert them, they're actually not very good at doing that either. And so because these processes are inefficient, it's best to supply a dietary source of these bioactive compounds if we really want to achieve adequate or even optimal health. And one interesting thing to note is that we can influence this process. So if we change the diet or we supplement in the diet, we can truly increase omega-3 fatty acids in the body. We can result in a change in the amount that we can measure in both the blood and the tissues. And so if our goal is to lean towards a less inflammatory state, then we can provide these precursors essentially that will help us achieve that. So as a summary, we can say that omega-3s are not endogenously synthesized in adequate amounts in the animal system. This describes the essentiality of the omega-3 fats. We can also say that the conversion process is inefficient in dogs and nearly non-existent in cats. So if we want to have these in the body, we must provide EPA and DHA in the diet or in a supplement. Supplementation of omega-3s can influence this process. We can significantly increase the amount of them in the blood and tissues by providing them in diet or supplements. And a deficiency of omega-3 fats can indeed result in some clinical signs and also suboptimal nutrition. And so what really is our goal? Do we really want to achieve minimal requirements in our pet diets or in our own diets? The question here relates to, do we want minimal health or do we want optimal health? And so we strive to improve the health of our patients, and to do that, our argument is that we should probably be providing more. We want a better ratio. We want to make sure we have enough of these present in the diet, and then we may actually be able to achieve some of the pharmacological effects of these nutrients. If we're influencing disease states by supplementing them at high enough levels, this is going to help us manage disease conditions, but maybe also we can seek optimal health by doing that. And so do dogs and cats need omega-3 supplementation? Based on my previous discussion I just gave you, my thought is yes, they can benefit from this in their diets. And so next we're going to talk through some cases, but also some disease conditions where these apply. For all the diseases, we will also go through a dosing strategy. So there's information we have. There's lots of studies that have looked at omega-3, so I'm going to outlay these for you a bit, and then we're going to go through those cases as I mentioned. So this is a chart I have put together that puts together information that was taken from a series of work done by John Bauer. He's probably the best known nutritionist that's looked at omega-3 fatty acids use in dogs and cats. And for dogs, we do have a described dose for these diseases listed on the left. idiopathic hyperlipidemia, kidney disease, cardiovascular disorders, osteoarthritis, inflammatory or immunologic conditions, and that would include atopy and IBD. And then at the bottom, the National Research Council, which is primarily our baseline text for nutrition recommendations, has provided a recommended allowance. They will give us minimal intakes, adequate intakes, and also recommended allowances for all nutrients, and EPA and DHA are included in that, and they also give us a safe upper limit for dogs for dosing. And so the first column is one we as nutritionists love to see, dosing based on metabolic body weight, but I know that's confusing. No one understands that. So I've also converted it to a mgs per kg per day in the middle column, and then on the right side you can see how much this effectively is for a 20 kilogram dog per day for each of these disease conditions. And so for dogs, you can see that the span of dosing really falls for most diseases in the range of about 50 to 150 milligrams per kilogram per day. And a general starting dose, what I actually use most often for healthy dogs, but also for dogs that have some diseases as well, I might start them at 50 milligrams per kilogram per day. As from my experience, this is usually very well tolerated, and I can enter into that range where I'm starting to see some of those health benefits. A safe upper limit then is going to be up as recommended by the NRC. My general thought is 175 mg per kg per day, but we do have some diseases where we are going above that. For cancer states, we might use 200 mg per kg per day. If you can remember, there used to be a Hills diet called ND, the cancer diet or neoplasia diet, and that diet included a very high inclusion of omega-3s, EPA and DHA at 5% dry matter basis, which is even above that 200 mg per kg per day dose. In the chart, you can see what that looks like at the low end of 50 mg per kg per day and at the higher end at 100 for each of these size dogs in kilogram of body weight. And so what about cats? Cats, unfortunately, we don't have as many studies in cats about different diseases. We have a few, but not nearly as many as we have for dogs. And the range for cats is described as 30 to 100 mg per kg per day. A general starting dose is around 50. We don't really have a safe upper limit that's been specifically determined, but the general feeling is caution is recommended with doses that are getting around 75 or higher. However, past the time that dosing was published, we do have several studies with osteoarthritis in cats, and they are using a higher dose of 106 mg per kg per day, and they use this safely for 10 weeks with no adverse effects. And several of the prescription diets readily exceed that 75 mg per kg per day, and I'll show you those in a few minutes. In the chart on the right, you can see the low-end dose and the high-end dose and how much that looks like on a milligram basis of combined EPA-DHA. So starting at the beginning, moms and puppies definitely benefit from supplementation of omega-3s. We can use them throughout pregnancy. While the puppy is still in utero, their brain and their retina are developing, so we're translating that benefit from mom to puppy. We can see that postnatally during lactation. We're also providing omega-3s. We're going to pass that potentially through the milk, but also then, starting dogs on their early diets. They're going to have some inclusion in their pet foods. And of course, as I mentioned, this influences brain development. We have some studies that show us trainability is improved for puppies that are growing on diets. And that is really the basis of that minimum DHA requirement per AFCO. This is more detail about that minimal requirement. The key thing here is it's actually very low. There is an alpha-linolenic acid requirement for puppies, ALA, at 0.2 grams per 1,000 kcal. There's also an EPA-DHA requirement at 0.1 grams per 1,000 kcal, which if you convert that over to what we're used to seeing in product guides, that's actually only 10 milligrams per 100 kcal, so that's pretty low. For adult dogs, there really is no minimum requirement for the specific omega-3s, EPA and DHA, but they do recommend that we meet a minimal ratio of omega-6 to omega-3s at 30:1. Again, home-prepared or ultra-low-fat diets commonly are very low or lacking unless they're specifically formulated and they include some source of these in the diet. And then oxidation of polyunsaturated fatty acids is a concern. So foods that sit around for a long period of time, especially if they're not stored properly, or if they don't contain sufficient antioxidants in them, we're going to see a loss of the polyunsaturated fatty acids as they become rancid in storage. And AFCO has recommended a minimum of 50 units of vitamin E provided as an antioxidant for every 83 grams of polyunsaturated fatty acids, which is not much, actually. Immune disorders are potentially affected and can derive benefit from supplementation of omega-3 fatty acids. Omega-3 fatty acids have been shown to alter the types of immune mediators that are present, and this can result in reduced systemic inflammation. If we have less inflammation in the body, this is going to result in less tissue damage, and ultimately that improves our outcomes, that improves quality of life, and hopefully it improves their survivability. Probably the place we are most used to thinking about omega-3s is going to be joint disease or arthritis. And we definitely have several studies, very good studies done to show us there is good evidence that omega-3 fatty acid supplementation can improve quality of life. It can reduce inflammation, and it can improve weight bearing when given to dogs at a sufficient enough dose to get those anti-inflammatory benefits. Here I've given you 3 studies, but there certainly are many more out there that show us that this is going to be beneficial. And if I'm backed into a corner by an owner and we're looking at multiple supplement options, because I know there's a lot out there, I will choose the omega-3s over a glucosamine supplement, which we have maybe weaker evidence that they actually derive benefit from. So for a case, this is one of mine. This is Zoe. Zoe is an 11-year-old male neutered Labrador Retriever that was 72 pounds, slightly overweight with a body condition score of 6 out of 9. He has some muscle wasting as well in his bilaterally on his stifles. He had bilateral TPLOs and has stifle thickening. He's slow to get up in the rear. We know he's got osteoarthritis in both of his knees, and he has an intermittent lameness in his left rear leg. And so this is kind of our classic older, large breed dog with osteoarthritis. And of course, we're going to work this dog up properly. We're going to get, radiographs and get a good assessment of where he's at, make sure there's no complicating factors. I recommend always, doing some baseline blood work screening and making sure we have a feel for what other health conditions are present, kidney or liver disease potentially. And as part of a multimodal therapy for this dog, we're going to consider, medications. We're going to relieve pain. We're going to treat inflammation in that acute phase. But looking long-term on the supplement side, we also can use omega-3 fatty acids as another tool in our toolbox to just reduce general inflammation in the body. And so for this dog, I start them at that 50 mg per kg per day dosing. I feel like introducing it there and giving them a little bit of time, just making sure they tolerate it well, making sure their GI is handling it okay, and then I'm going to work him up. And for a dog like this, I'm going to probably aim for at least 100 mg per kg per day. But if I don't get good results from that, I will definitely go to maybe 150 and see what I get from there. For these guys too, it's important to look at diets that they're consuming and make sure we have an appreciation for if there's omega-3s in their diet, especially if it's a prescription diet. I'm not worried if it's a commercial diet necessarily because they don't contain the higher levels that the therapeutic diets will have. But putting those together so that you're thinking about that when you're dosing these as well. And so this would be the kitty version of that same scenario. This is Tank, and Tank is a middle-aged, he was 7 years old, very overweight at 23 pounds. His body condition score was 8 out of 9, and Tank is our classic couch potato cat, does not want to do anything. But we found on physical exam that he definitely has some issues with his hock. His owner noted he had an intermittent lameness in his right rear leg, and we worked him up. We did some sedation, x-rays, and we see that he's got some arthritis in both of his hocks and his rear leg. So he really has a reason not to move around. And I think One thing I do come across in these overweight cats is we want to make sure we're really looking at is there a reason that could be contributing to their inactivity? And it's true that heavier cats just will move less. But definitely suggesting to owners, do a good workup, see if there's arthritis, and let's manage that optimally. Let's make sure we're covering that base. And of course, for Tank, just like for our previous case, we're going to do some lab work testing, make sure we're ruling out other health conditions. These big guys, I'm making sure they're not diabetic or where they are in that spectrum. We're going to put him on a weight loss plan. We're going to make sure his diet is well controlled. As the nutritionist, that's certainly a priority for me. But then I'm also going to try to make suggestions nutritionally and on the supplement side that is going to support his mobility. Movement needs to be a strategy in all of our weight loss plans. How can we get this cat moving? And that's something we focus on our feeding recommendations, how we're going to present the food. Maybe we're going to use food balls. We're going to move the food around, and we want to make him comfortable. So supplementing omega-3s can be part of that plan. And for Tank, I again start him at 50 mg per kg per day, and I probably would leave him there as being a cat and see if that is sufficient. Sometimes I will go a little higher than that. I'm not afraid to do that because I know the therapeutic diets contain omegas at higher dosing, but definitely just reading your patient and taking cues from how they're tolerating it, how easy are they to get the supplement in them is a concern, and then going from there. So skin, and I'm sure this is a very common scenario that we're all thinking about adding omega-3s potentially to the diet. And we do have several good studies looking at skin and omega-3 supplementation. It has been shown to reduce pruritus and self-trauma, both in dogs and cats. And we can also see improvements in the coat health that includes the skin and the hair coat. It has actually shown to be able to reduce dosing of medication if it's given in combination with that. Here's one study that looks at atopica with dogs. So definitely a good option, something to think about, another thing in our strategy. And so this is a case, Marley Sky. Marley Sky is all of our worst nightmare. She has a pretty severe pododermatitis. I've seen several cases of these in my general practice, and I definitely have these come to me as a nutritionist. Primarily, we're doing hypoallergenic food trials or elimination diets, investigating the potential for food allergy as a component. Marley Sky was 7 years old. She came through a rescue. She was around 60 pounds. She was at an ideal body condition score, and she had these draining tracts present really for the 3-month period of time that she was going through rescue, trying to find a good home. Working these up is super essential. Definitely, we're doing cytologies and cultures, and these dogs are going to need medication. They're going to end up on anti-inflammatory medications like prednisone, appropriate antibiotics. But also here is an opportunity to have multimodal therapies, and omega-3 fatty acids can be part of that. I definitely use these for these cases. I start them on early and work them up, and I'm using the higher end dosing for these dogs as well, aiming for 100 mg per kg per day, but even considering going higher if I feel like they're tolerating it well and that they're going to get a benefit from that. Marley Sky did pretty well. We were able to get her started on this. We did do a hypoallergenic food trial, and she probably was about 75% improved. I wouldn't say she was cured by any means, but she did transition from prednisone over to cyclosporine, but was able to taper the dosing in combination with omega-3 fatty acid supplementation. Heart disease is another opportunity to supplement omega-3 fatty acids. We do have studies that show us we can delay or possibly prevent the onset of cardiac cachexia. So this is the wasting syndrome we see with dogs, especially those that are developing some signs of congestive heart failure. We do have studies also that show we have less arrhythmias if they're supplemented with omega-3 fatty acids. So both of those concerns, definitely, since heart disease affects approximately about 11% of our patients, is I think the last statistics I saw. I think there's a good benefit that we could consider by adding this to their regimen. Also, gastrointestinal diseases. We have some literature that's looking at inflammatory bowel disease specifically with omega-3 fatty acid supplementation in combination with hypoallergenic diets. And the two together was shown to be somewhat superior to just diet change alone. And so reducing inflammation systemically in the body can definitely be a positive benefit for dogs with this condition. One caution is I am careful about dogs that have fat intolerances. And so this might be a case where if it's introduced very gradually and making sure that they're tolerating okay. I'm also looking at total fat intakes. So when I have a homemade diet formulation, I'm limiting fat, but I'm making good choices about where those fats come from. So I'm going to count the omega-3 as part of the fat as well as the omega-6, which is essential as well in the diet. And this is my case, Jane. Jane's been a patient of mine actually for several years, going back from pre-nutrition residency to now during nutrition residency. She's had a pretty extensive history of chronic diarrhea and weight loss. She's now an 8-year-old lab Sheltie mix and weighs about 42 pounds, and she's stayed on the thin side despite all of our efforts. But we were able to get her stable on a homemade diet. Eventually, we went through actually 3 elimination diets and were able to get her doing the best on a homemade diet plan that was using a canned rabbit product that's made by Rain Clinical Nutrition. And during this time, she also developed proteinuria. So she is now a chronic kidney disease stage 1 dog. So we were able to limit protein intake and phosphorus intake with the homemade diet, but we also added in omega-3 fatty acids. And what we found in combination with medication, she was started on telmisartan, that we were able to lower her UPC numbers more than 50%, so almost get it back down to a normal level. And she tolerated that quite well with a gradual introduction for this dog. I also introduced that at the 50 mg per kg per day. There is a dosing for glomerulonephritis that is roughly at 140 milligrams per metabolic body weight, which is around 75 mg per kg per day. And that was where we ended up leaving her. Urinary tract disease, another one you may not be thinking about, but here's an opportunity also to reduce inflammatory states. And there have been several studies looking at the use of omega-3s for these guys. And of course, we're going to look at the whole environment. We're going to treat this as we would any other patient. But adding omega-3s can be a good strategy to help improve quality of life. This was one case I worked on. Her name was Ruby, and she's a 9-year-old female spayed Norwegian forest cat. She's 10.5 pounds. She's slightly overweight with a body condition score of 6 out of 9. And over the past year, she had 5 episodes. Understandably, mom was super frustrated because this kept coming back. Currently, she presented the last time with straining and frequent trips to the litter box. And her diagnosis, of course, is feline lower urinary tract disease. And so we're going to work these cases up as we normally would, looking at environment, behavior, stress in the home. We're going to choose potentially, diets that are going to help us manage this. I'm recommending higher moisture diets. And then also as part of our strategy with medication, we might think about adding omega-3s in the mix. And Ruby actually did really quite well. Surprisingly, we have some cats that really actually like fish oil and they'll eat it just in their canned diet, squirted right in there. And so Ruby was started at 50 mg per kg per day of a fish oil supplement, and she loved it. And she has been now, I think, over 4 months with no symptoms. So we feel like we made a difference there. And another opportunity here, this may be one that you're not thinking about, and actually is something I didn't think about for a very long time, was dry eye or keratoconjunctivitis sicca. There actually are human studies that show humans with dry eye will do better with omega-3 fatty acid supplementation. And now we do have a study that looked at this in dogs, and it does confirm. They looked at tacrolimus in combination with a low dose and a high dose omega-3 supplementation, and both dogs that were on the omega-3s actually did better than the ones just on tacrolimus by itself. And so after learning this, I tried this. This is Pudgy. Pudgy is a 14-year-old female spayed pug. Came in at 15 pounds. She's overweight with a body condition score of 7 out of 9. She had some muscle wasting. She's got the patellar luxation they love to have. And she had pretty severe ocular discharge, lots of things, lots of badness going on there. In working her up, we also, diagnosed her with diabetes 2 months ago, 2 months prior to this presentation. And the eyes seemed to deteriorate after that diagnosis was made. We definitely had low tear production in both eyes, ulcerations, and just really bad crusting was present. And so, of course, we're going to do all of our normal treatment plan. We're going to work on getting her diabetes under control. We're going to treat the eyes appropriately with staining and antibiotic therapies and lubrication initially, and she was started on tacrolimus. We also started her on omega-3 fatty acids as a strategy. So she's got a couple conditions here that give me indications to do that. She probably has some level of arthritis, being a 14-year-old dog, but we know she's got the patellar luxation in both knees. She is overweight. She's an obese dog, and we do say that obesity is a state of inflammation, and so these dogs will benefit from supplementation on that level. But then also the dry eye, I wanted to see if maybe we can make some improvements. And so Pudgy was started at the 50 mg per kg per day and worked up over a period of several weeks. We got her to about an 80 milligram per kilogram dose. But then we started to have a little bit of soft stools or diarrhea. So I backed her back down to the 50 mg per kg per day. And she did improve. She actually made improvements over those first 3 months in her tear film testing. And she was able to reduce her tacrolimus dose to once a day. And I wanted to say that omega-3s were part of that. Of course, I probably can't say that for sure, but I do believe that they're a benefit to her. So neurology, neurologic disorders, another thing to think about. Omega-3s have been studied for cognitive dysfunction. They have been looked at for dogs with epilepsy. And then we do have some studies looking at behavior. Specifically, we have found low omega-3 status in aggressive dogs. As I mentioned before, trainability for puppies is better if they need to have that source of DHA in their diets. Epilepsy, the jury is still out. There are some case control studies that show there was a positive benefit for dogs in reduction of seizure frequency when they were started on omega-3s. But then we have some conflicting studies that also show no benefit. So I will try it. I will try it with my patients only because I often have multiple reasons to use them. And I do have one case to share with you. This is Ozzy. Ozzy is a 3-year-old male neutered golden doodle. He's 81 pounds. He's at an ideal body condition score, and he had a really pretty significant seizure disorder. Starting at the age of 2, he was having 4 to 5 seizures a month. He was working with a neurologist and had all the proper workup. He came to me as a nutrition consult because he was also having intermittent diarrhea and soft stools. And so, and per the owner's preference, they wanted to put him on a homemade diet. So that was an opportunity for me to, optimize his diet, but also recommend, let's go ahead and try him on omega-3 fatty acids. And so we did incorporate that in his diet plan. He also, unfortunately, was on 3 anticonvulsants at the time, and his neurologist was starting him on a 4th. That combination plus starting on omega-3s, actually Ozzy has now been seizure-free for 4 months, but he was started on potassium bromide at the same time. He tolerated the omega-3s very well, and just changing over his diet is not having any issues with diarrhea anymore, even on the omega-3 dose. And I started him on the 50 mg per kg per day, but he's definitely up to 100 mg per kg per day at this time. And so what about cancer? There is lots of papers, lots of work done in humans looking at the benefits of omega-3s with different disease states and specifically different cancers, and they're showing positive results. We unfortunately have very few studies that look at these same effects in our dogs and cats. We do have one series that was done by Dr. Ogilvie looking at lymphoma in golden retrievers. And that showed us that a diet that was lower in carbohydrate, that included omega-3 fatty acids, it It also was had a higher level of arginine and other antioxidants, and they were able to show that in combination with chemotherapy, they were and the omega-3s and all the features of the diet, they were able to extend their lifespan by several months. So that's one positive result. We know there's been some diets available to us, as I mentioned, the Hills ND diet that had a very high level of omega-3s included. And I will try omega-3s with my patients for any type of cancer, because again, I often can find multiple indications as wise to use them. And I shared this paper with you because this was a recent paper that was put out in 2021, earlier this year, actually. That was a compilation of all the studies that have been looked at, randomized controlled studies of omega-3 supplementation. Then they separated out cancer and also all the non-neoplastic companion animal diseases, which were the ones I mentioned earlier. And so this is Major. Major is a 3-year-old male neutered husky shepherd mix. He came to his veterinarian with enlarged lymph nodes, and unfortunately he was diagnosed on fine needle aspiration with lymphoma. He did visit an oncologist, and he was enrolling in a chemotherapy program. He came to me as a nutritionist because the owner was seeking to put him on a properly formulated lower carbohydrate diet. And so we did that, and I did also include omega-3 supplementation into his diet, and I dosed him gradually up to 200 mg per kg per day as part of his treatment plan. And now he is currently in remission at approximately about 4 months out. And so here I'm going to tell you the levels that are coming to you in different therapeutic diets. So this is a useful chart to just kind of take a look at all of the therapeutic diets listed by category on the left side of the screen: joint diets, novel protein, hydrolyzed, renal, gastrointestinal, and weight loss. And you can see across the company's diets that offer therapeutic diets, there's different ranges of omega-3s that will come to you in them in a milligram per 100 kcal basis. The joint diets are going to be the highest. And behind that, probably renal diets. Some of the novel protein diets are higher, but interestingly, the gastrointestinal diets are lower in omega-3 content, and then some of the weight loss diets have some, and then others do not. So it's good to be aware of that, and you can find this sometimes in the product guide, sometimes you have to call the company to get that information. And so if we look at this calculated out for a 20-kilogram dog, roughly 44-pound dog, this dog we expect to eat about 927 calories a day. What does that look like in each of these diets? So you can see how much that is on a daily basis for each category. And then if we compare that to the recommendation for that disease state, are we making it with the diet by itself? And in some cases we are. So joint diets, we can. Some of the novel protein diets, these are on the average across all of those diets, but we may not get there if we're on a GI diet. So it's good information to be aware of if you're feeding these diets and looking at that in combination with supplementation. And so what about cats? This is the same chart for cats, milligram per 100 kcal basis, how much of EPA and DHA is coming to you in each of these categories. You can see that many of the cat diets actually have less, or there isn't a diet available for that category. And similarly, some of the joint diets are higher, the renal diets are higher, and then the gastrointestinal diets are the lowest, and the weight loss diets, curiously, are the lowest in cats. And so here I've calculated that out for how much is that per day for an average 4-kilogram cat. And we think of them to consume maybe around 277 calories a day. This is how much they will take in EPA, DHA from an average across those diet categories. And then we don't really have a defined dosing as well for cats for disease states as we do for dogs. So what I've done is compared it to 75 milligrams per kilogram per day dosing, and then also to 100 milligrams per kilogram per day. And you can see that some of these diets we're going to meet and exceed that level just by the diet, but then in other cases we won't, and that's primarily GI and weight loss diets. So we need to mention the possible adverse effects of omega-3 supplementation, and these are things to be aware of. I would say across the board, I feel it's one of the most safest supplements that we can use. It's very rare that I do have any side effects. I have not had cases of these adverse effects in my practice, but I always do keep them in mind, especially if they're on multiple medications or if they have a disease condition that might alter how much I'm giving. So probably the most common actually is GI adverse effects. And this is why I've graduated towards this gradual introduction. I have my target dose and I have my initial dose, and I'll work that up slowly. And that just gives the GI a little time to adapt, and I can test the waters before I hit them with the highest dose. But altered platelet function, altered wound healing, lipid peroxidation, all of these have been mentioned as concerns potentially, especially at the higher end dosing. Nutrient excess, so that would just be too much fat in the diet. I think that's really hard to do with the supplement because generally it's not that much. But you can also have toxin exposures if they're bringing in contaminants, if it's not a exceptionally pure product, and this is where product choice makes a big difference. Weight gain, in theory, could be a concern. I think that is something I think about more with my very little dogs, small dogs, and cats that are on very closely calorie-controlled diets. Then we might be counting all of these calories coming in. Altered immune function, again, potentially effects on glycemic control and insulin sensitivity. And then, of course, there can be nutrient-drug interactions. Anytime you're bringing in more fats and they're taking other medications, you could have some interferences there. So quality concerns, as I mentioned, the purity of the product does matter. We want to choose a good quality product. Oils can have residual or small, minute amounts of proteins, primarily fish, obviously, if it's a fish oil, and that could be problematic for food-sensitive patients. So in theory, oils should be pure. They should not contain proteins, and this means as long as quality steps are in place to prevent that even patients that are allergic to fish can still have fish oil. But other concerns might be heavy metals such as mercury, the PCBs, and also the dioxins that come in. Those will be questions you'll get from owners. So you want to make sure you have chosen a good product. And newer products will be using algae, calamari, or krill, and they are expected to have fewer contaminants. And what about the ratios? Omega-6, omega-3 ratios is being looked at more and more, and we know that in our diets, probably the average human diet, we might be looking at a 20-to-1 ratio. So there's a lot more omega-6s coming in compared to the omega-3s. And so this has been evaluated as potentially this is not healthy. And since we know omega-3s have the anti-inflammatory effects, converse to the omega-6s being more pro-inflammatory. And so it's been suggested that seeking a ratio of 5-to-1 would be a much better place to be. That's both for humans and dogs and cats. Commercial diets could be as high as even 30-to-1 based on their ingredient list. What could be a little bit confusing is the discussion between what is more important, the total amount versus the ratio. And so for right now, I usually tell people we look at the total amount that's coming in only because we understand and know more about that. But as we learn and learn more about ratios and diets, I'm feeling ratios are also important, and we're going to start to consider that more and more over time. But there are some challenges in the literature right now in that historically, the way they report these ratios is not consistent. So N6 and N3s, or omega-6 and the omega-3s, obviously have components to them. If some of them look at all of them, so LA, GLA, and AA compared to ALA, EPA, and DHA. Some only use the parent compounds, LA and ALA, or they might use the most potent, the more biologically active molecules, just the ALA, LA, excuse me, or EPA, DHA. And then some studies only use the marine sources, and they are looking at those, or others use the vegetable-based ones. So the method of calculation must be stated to compare studies, and my hope is that this will become more standardized over time. And this is my last slide. This is my handsome boy. His name is Lincoln. He is a 2.5-year-old English Cocker Spaniel, and I bring him up because he actually participated recently in an omega-3 trial. We tested his omega ratio and found that he was actually on the higher end. He was about 19, and it suggested to have a range there between 5 and I believe it's 17 as an optimal range on the test. So he was a bit high, and he was started on a dose of omega-3 fatty acids, 450 milligrams of EPA DHA, and for his body weight of 32 pounds, that was about a 31 mg per kg per day dosing. And what we saw over the period of 3 months is that his omega quant ratio was reduced all the way down to 3, and less than 5 is optimal. So that's impressive. And what we did next was actually take him off and let him go without for another 2 to 3 months. And then we tested him again, and his number went back up to 15. So what that showed me and what I learned is that we can influence this ratio by doing supplementation. So I felt good about, he probably needs to stay on one if we want to keep him down in that ideal range. And I will also say that I noticed he had some random sort of crusty skin that was very minor, but noticeable to me. And that did go away when he was supplemented on omega-3. So that's the N=1 story, but that's my personal story. And I thank you for your time today.